and environmental racism, how that is, how they are impacting the African American community in terms of coronavirus and COVID-19. When we look at environmental racism, when we look at the structural inequities, and when we look at the high number of African Americans dying, tell me about that correlation.
Yes. So it's so deep and so it's yeah, and the tendrils and tentacles are so many. And as Dr. Bullard said, it really starts from our enslavement, whether it's during the slave times when the types of the foods that we got up, there was the scraps that were left over, and that being the diet that is not a health sustaining diet. It's only a diet that would enable someone to survive enough to provide the labor that was being required of us, or the intentional breaking of our families during enslaved times, the intentional separation of families. And then we see that going into modern day, whether it is the way the social service system is set up to keep families separated, to the modern day redlining and the separation from the types of foods that are health sustaining and enabling us to thrive and be healthy, to the types of to the even the war on drugs and the way it was played out in our communities. There, all of that is directly connected, and then all of that plays into and even our education system. So all of that plays is directly tied to environmental issues when we talk about the foods that are available to us. And as we see with climate change, then it's actually shifting the availability of nutritious foods. It's shifting our agricultural yield, so it perpetuates that and makes the food insecurity that we already disproportionately have even greater. When people talk about food deserts, and they're being more likely to be in our communities, but communities, I know that even we act talks about how the communities don't like the notion of the term food deserts, because deserts are something that happen naturally. But we all know that whether it's gentrification or redlining, all of these are intentionally separating us from those resources. And we also tie to COVID-19, it's not necessarily, well, it's one thing in terms of the types of labor that we have, and how we're on the front lines of being more likely to be infected in the first place. But then it's also what the infection is going to do to our bodies if we're the ones who are living next to the smokestacks, where our lungs are already under attack and
Yes.
already weakened.
Yes.
uh, then we are more likely to have these fatalities from it as a result to already weakened lungs. So I could go on and on, but Lubna has a lot more to say as well. So
Well,
those,
Luke, now I'm going to you. You know what? Why are we dying at disproportionate rates? Jackie, mentioned, our neighborhoods being in places where there are plants and factories, and that pollution is impacting our lungs, right? And there's a high risk uh, when you get the coronavirus, COVID-19, of being infected, and then you're not having a greater chance of living because of where you live in terms of where you are placed. Am I on to something, or?
Yeah, absolutely.
Okay.
As Dr. Bullard mentioned, like your zip code is often more indicative of your health outcomes than your genetic code. And, in a place like Harlem, where we act as based, we are seeing a disproportionate amount of polluting facilities located in these neighborhoods. When you're talking about ambient air, your outdoor air quality, you're talking about emissions from vehicles, buses, trucks, but not only are those on, the roads and the highways around here, it's also the facilities that store those vehicles, like bus depots, are disproportionately placed in the uptown neighborhoods here, for example. So 5 out of the 6 bus depots in the island of Manhattan are located north of 100th Street. And that's, not by coincidence. They were intentionally placed there because, and thinking about, how much emissions that creates from the buses going back and forth for the air quality here. the childhood asthma rate in Harlem is much higher than the national average. And that's only talking about outdoor air quality. I mean, I often think about this through the lens of a child where your body is still developing. You know, you may be outside and playing with your friends, and then you go and you go home and, you know, thinking about your indoor air quality. Harlem, for example, has one of the largest concentrations of public housing in the nation. And people are dealing with a lot of infrastructural issues. You know, the NYCHA, New York City Housing Authority, is a highly negligent landlord. People are dealing with leaky pipes, you know, cracks in their infrastructures of their, you know, walls and roofs, which leads to the development and persistence of things like mold and pests. You know, there's a lot of issues with poor ventilation. And now we're asking people to shelter in place and not thinking about what that means for different people, communities.
That's a good point. You're asking people to shelter in place, and the place where they are located may not be the healthiest place, right? You mentioned the mold. You mentioned it may be asbestos. It may be so many environmental factors just within your own place when you ask people to shelter in place. I'm going to Mr. Royal right now. In the he was featured in the ProPublica article, but there also was a young lady who, you know, who lived in a neighborhood in Milwaukee, but had to catch several buses to where her job was. And because of where she lived. And so the jobs are not necessarily in neighborhoods, and you're risking your life, whether you have a face mask or other type of protective gear, just trying to get to a job. Mr. Royal, could you speak on that and what's going on in Milwaukee?
Certainly, and that's one of the misinformation things or points that always come out about locations of jobs and the city not having jobs in neighborhoods where individuals need jobs. This city has $11.8 billion in wages created annually. 7.9 billion of those dollars are exported to other communities. So meaning that people come in here every morning, go to work, take those dollars and go back out to the suburbs. So jobs are plentiful here in the city of Milwaukee, and it seems like all our European American friends in the suburbs around us know that fact, and they wake up every morning and come and get those dollars and take them back home. But it seems that when we talk about structural racism, the laws of racial equity and inclusion that are on the books aren't enforced and administered the way they're written. Meaning that if there's supposed to be certain percentages of jobs that go to folks that are low and very low income, or to minority contractors, or to minority professional services, of X amount of dollars are supposed to go to minority vendors for procurement, those requirements are not being met. And you can look at it from the city level, from the county level, or from the state level. So if those requirements were fulfilled, there would be more opportunity for individuals who live in a closer proximity to where those opportunities are supposed to be afforded, so they wouldn't have to take all those buses and extra risks to be exposed to the potential of this pandemic.
When I spoke to you, we talked about The Color of Law by Richard Rothstein. And he mentioned his whole book is about what Dr. Bullard was talking about, which is housing segregation, right? In terms of how the government actually sponsored segregation through redlining, through zoning, through all kind of laws that kept African Americans on who in certain areas. So we're asking, I have questions to the panelists that I'm going to get. This is from Alexis. She wants to know about data and studies that suggest which of the many risk factors facing the African American community is most associated with the COVID infection and death rates. Is it access to medical care, underlying health conditions, or job type? So we're going to go with Dr. Bullard on that one. And then I want Jackie and Lubner to weigh in, as well as Mr. Royal. So this is what Alexis is asking. Is there data or studies that suggest which of the many risk factors facing the African American community is most associated with the disproportionate COVID infection death rates? And she mentions access to medical care, underlying health conditions, or what type of job that you have. You want to take a stab at that, Dr. Bullard? Thank you, Alexis, for that question.
Well, thank you, Alexis. I don't think that data has been disaggregated just yet. It's kind of early. But even before COVID-19, there were Black people dying disproportionately because of these health disparities, these social determinants of health. African Americans having diabetes at 60% higher than for whites, heart disease, asthma. As I said before, African Americans and Hispanics being hospitalized for asthma at 3 to 5 times the rate for, I'm talking adults, than whites, and Black children dying 10 times greater. We talk about, the unhealthy conditions in which people of color find themselves. This was before COVID, and so these disparities that existed before, and we can look at those data and talk about the comorbidity, the things that's killing folks off in greater numbers before, and what COVID-19 is showing, that when you add on top of those disparities pre-pandemic, you're getting the sickest people. You're getting the weakest people in terms of immune systems. You're getting people with already respiratory illnesses like asthma and other kinds of diabetes and other kinds of illnesses. So if you want to map where the vulnerabilities are, you can map the health disparities before the pandemic, and then you overlay which zip codes or which neighborhoods will most likely be the hot spot. And it's not rocket science, and it's more political science. And the gentleman was talking about transportation. Transportation has always been a civil rights issue in this country. Plessy v. Ferguson, 1896, basically was about civil rights and transportation, access to transportation. Rosa Parks, the Montgomery bus boycott. So who has access to an automobile? Right now, only about 5% of white people in this country don't own a car. But if you look at African Americans, about 19%. You go to your cities, in some cases, it's 34%, 35%. So access to transportation to get to jobs and get to healthcare and get to things that make healthy, it's all related and linked back to racial dynamics and class dynamics. And health right now, as I said before, health dynamics and access to healthcare is still a major problem. And if you look at the highest concentration of uninsured, is among poor people and people of color. And if you look at those states that didn't expand Obamacare or Medicaid, they're red states for the most part.
Right.
And if you look at where the communities that have the highest concentration of uninsured and sick people, that's where COVID-19 is striking fear and death. Not rocket science. You don't need to have a PhD from Harvard to understand this. These are the same communities that have the highest concentration of pollution. America is segregated, and so is pollution. You find the pollution, you find the segregation, you find the bad housing conditions, you find the bad environments, you find the bad health outcomes. That's where you're going to find these numbers. That's where you're going to find these numbers. And as I said, it's not magic, it's not voodoo, it's not a mystery. And people who deal with health and deal with environment and deal with disparities, it should not be shocking. For those who've worked on this stuff for 40 years, this is not shocking in terms of a surprise. It's shocking in terms of what we should be doing to eradicate these disparities.
So we're going to get to that. But, I think you just said a lot of stuff, Dr. Bullard. Oh, my goodness. You said that the states that refuse to expand Medicaid are mostly red states where there are predominantly minority communities, low income communities, and these are the communities right now that are being impacted the most with coronavirus, COVID-19, or have the largest health disparities. Is that correct?
Yeah, what I'm saying is that the communities that need to have access to healthcare and access to health insurance, these are the same communities that are overpolluted. I live in Texas. Texas has the highest concentration of uninsured. Look here, I sit here in Houston, the fourth largest city, and you look at the highest concentration of uninsured in Texas, in this blue city, are people of color, Latinos and African Americans. And so the idea that somehow healthcare is not, and access to insurance is not related to good health outcomes is a myth and a misconception. And so it is not by accident that the same states that resisted civil rights, the same states that resisted equal environmental protection, these are the same places that now want people to go back out and get sick and risk their lives and opening up the country, the economy too soon. Understand that there's a relationship between the politics, the pollution, the health outcomes, and basically writing off people and saying, well, they're just expendable.
So we know
people of color have to die before this thing is taken seriously. This has to be changed and challenged.
Whew, Jackie, I'm gonna go to you. I don't know what to say about that.
Yeah.
But Alexis was asking about data and studies in terms of the disproportionate number of African Americans dying of and being infected with COVID-19. She mentioned access to medical care,
Mhm.
underlying health conditions, and she mentioned, what type of job you have in terms of, why are we dying from this? You want to tackle that? Dr. Buller, you just gave me a whole bunch of stuff to contemplate over here.
Yeah.
Yeah.
So before this pattern, long before the pattern began to emerge in terms of the disproportionate impact, we put out our report, the 10 equity implications of COVID-19 pandemic. And then we grimly and with dread predicted that this would be the pattern that would emerge, because all the data is already there, as Dr. Bullitt said. The data is already there about our uninsurance. The data is already there in terms of us being more likely to be in these jobs and not having the luxury of being able to social distance, because we are the essential workers that are now on the front lines of these impacts. The data is already there in terms of even when we go into care, the extent to which we're getting the quality care that's actually going to be life-saving. You hear of these great stories of people surviving after this and that, and that's not usually the Black folks that are these great stories that are happening. Someone who's read his last rites, and then he was able to, and God bless him for that. And those stories are too often not us. We're the ones who are, we have levels of breast cancer, but then we're more likely to die from breast cancer. We have we might have certain levels of asthma, but then we're more likely to die from asthma attacks. We're more likely to be amputated instead of having our limbs saved. So all of these point to the fact that we don't have, even when we are fortunate enough to have any type of healthcare, the same level of care, treatment, and survival after treatment. And so all of these, and we talked about the poor air quality and the fact that 71% of us live in areas that are below EPA standards that aren't even sufficient. And then we have, at the same time, now we have the rollback of monitoring and enforcement of even those paltry environmental standards that we had in the first place. And it's our communities whose lungs are being disproportionately attacked, leaving them more vulnerable to the impacts of COVID-19. So all of the data was there in terms of, and then on top of it all, the fact that the misinformation that was going, and the fact that we can't even ever normally trust information that's coming. We talk about conspiracy theories,
yes,
and so forth, but those theories are based in historical fact, whether it's the Tuskegee situation, Henrietta Lacks. The stories are so many in terms of the ways that we've been misused and misinformed to fatal impact for our communities. And so all of that leaves us more vulnerable to not necessarily believing the advisories that are coming out, because are those advisories really for us, or are they meant to again harm us, as so much as has happened historically? So I'll pause there and hand it off to Lubna.
Jackie, could you mention the environmental and climate justice 10 points again? Could you say the title of the?
Oh, yes, the document, the 10 equity implications of the COVID-19 pandemic. That's the NAACP. We put that out on March the 13th, and we're updating it every week with new information as things continue to unfold.
So
But in
please
that
go
document, from back then, that all of this was good, that this pattern of disproportionate impact and disproportionate mortality was going to happen, because we know what the data is for our community as it stands, and we knew how it was going to intersect with what we already were beginning to understand about COVID-19.
So people can go to naacp.org and
/coronavirus.
access
Mhm.
the
NAACP.org/coronavirus.
implications,
And then they can find that document
and
first.
then you will find the document. So I encourage you to go to naacp.org to get the 10 inequities implications. Lubna, let's talk about job type. In terms of the type of jobs, I'm thinking about the young lady the 5-year-old who died in Detroit. Did you guys hear about that? She died of coronavirus, COVID-19. Both of her parents were frontline workers, right? And Mr. Royal hinted on this earlier, and Dr. Bullard talked about this as well. But Lubna, I want you to expand on this, on the type of jobs that, that the lower wage job, the minimum wage jobs, we are on the front lines, and we're out here every day because we have to feed our families. We have to pay for our homes. So could you go into that and the type of environments that we are going into, and when we come back, we are basically impacting our families. I'll let you take it from there.
Yeah, absolutely. I mean, some of the most frontline workers are located in environmental justice communities, not to mention just other jobs in like the service industry. Many jobs that we see aside from those that are, directly involved with polluting facilities, people like nail salon workers, people working at local restaurants, so many people are out of a job right now. And right now with our economy crashing, we need to be thinking outside of the box in terms of how to stimulate the economy by addressing climate change at this time. We're looking at all these facilities that are abandoned, for example, like public spaces, public oriented spaces, like, senior living homes and larger gathering spaces that have had issues of infrastructure. So for example, like not functioning air conditioning systems.
Right.
If we were able to spend this time right now focusing on good green jobs and getting, growing the workforce amongst people that are most affected by COVID-19 right now, encouraging, free trainings for people to get, trained in this type of workforce that will exist even after the crisis is over. And I think that's a super important consideration right now. Through We Act, we have a OSHA training program. People are trained in solar installation and other types of work. And it's like, why are we not building that infrastructure right now? Why are we not spending time working on how to remediate issues with extreme traffic, how to alleviate issues of extreme heat in the summer months by ensuring that windows are being replaced and air conditioning installations are happening. I mean, these are things that can happen while also practicing social distancing, and ensuring that we're putting money back into these neighborhoods and ensuring that they'll thrive after the crisis is over.
So I'm looking at the bus driver who died in Detroit. I'm looking at the police officers also who died in Detroit. I'm looking at the caretakers in nursing homes who are being infected. I'm looking at those who work in grocery stores who are not only, stacking the shelves so you can have toilet paper, right? But who are also manning the checkout lines. I'm looking at the people, you know, who are working at Walmart and have to come in contact with people who refuse to wear face masks, right? I'm looking at those jobs and how we are disproportionately, you know, in those jobs because we have to feed our families. And we have to, as Mr. Royal mentioned, we, you know, a lot of the jobs are not in our own neighborhoods. We have to, you know, take several buses. And, you know, the guy in Detroit, someone is coughing on the bus. He's risking his life. And, you know, a month later, he dies. Mr. Royal, I'm going to go to you. And I want you to tell me about, you said several people that you know have passed of coronavirus COVID-19. And then I believe you said you had a cousin, am I correct?
Yes.
And so just in the Milwaukee community, there's a disproportionate number of African Americans dying from coronavirus COVID-19. Tell me what is going on in Milwaukee and what is being done about that?
So let me clear up one statement that you made.
Okay.
There are opportunities for employment throughout the city of Milwaukee, right here in my neighborhood. But those opportunities aren't being afforded to people that could do those jobs. People are coming in from other communities and providing those services in our city that we could be providing for ourselves.
Yes.
That's one thing. But when we talk about the individuals that you just listed as being frontline workers, there's a social economic gap there, because some of the people that passed in the city of Milwaukee were past firefighters, police officers, adjunct professors at colleges that had good healthcare benefits, supposedly good access to healthcare. But we know structurally there's a racial disparity in the treatment of African Americans in the healthcare systems. And if you look at Serena Williams, when she had her baby and almost died, you could see that illustrated very clearly pre-coronavirus. So these structural racist attitudes within the healthcare systems contribute to the high rates of death, mortality amongst African Americans here in the city of Milwaukee.
And other people, I mean, you named not only those who were police officers, but people who also who were professors and worked at the university level. So we've known celebrities, like you said, who have musicians, actors, actresses, who have all passed away from coronavirus COVID-19. And you're pointing to how people are treated once they enter the healthcare system. Is that correct?
Yeah, one of the clearest illustrations is the past opioid addiction that spread it through predominantly European American communities, because the healthcare system had this predisposed notion that African Americans had a higher tolerance rate to pain. So they didn't prescribe pain medications to us, which for once was a good thing.
I want to talk about solutions. We only have a few minutes left. Well, actually we have maybe. I want to talk about solutions in terms of environmental justice. What can we do as individuals, what can be done at the local and state levels, and what can the federal government do in terms of environmental justice? So let's start with what can we do as individuals, and then what can we do on the local level? We'll take those two first before we, talk about the federal government. So Dr. Bullard, I'll start with you.
Well, I think there's a lot that we can do, and the fact that there's no substitute for organizing, mobilizing, and educating ourselves about the political process as well as the economic system, and that there won't be any rescues coming from the outside. What will happen that's positive from within. And I think building organizations, building coalitions, building networks, community university partnerships. We have an HBCU climate change and HBCU equity coalition of 35 institutions spread across 16 states, educating and transforming communities, one community at a time, and building those relationships, empowering and building the capacity of non-governmental organizations in African American communities to do for themselves, and challenging local governments and challenging elected officials to be accountable. And if they're not accountable, vote them out. And to show how money flows when it comes to addressing disasters. And what we have to do is to fight like hell to kind of like reverse this dominant pattern of disaster recovery dollars flowing to money following money, money following power, and money following whites, as opposed to money following need. This is, when you talk about billions of dollars coming in after hurricanes, floods, and now this pandemic, we have to fight to make sure that the right people in organizations get that money, and not have small business rescue dollars flow to big companies to rescue big companies and under the guise of small business. We have to challenge that, and we have to monitor. We have to make sure that we track what's going on, and not be afraid. And we have to be, just outlandish in our fight for justice. And if we get pushback from people, we say, so be it. We have to fight as if it's our last day.
So you mentioned how, dollars flowing to rescue big people, and small businesses are being, left out. I'm thinking about Ruth Chris Steakhouse, who got $20 million.
Yeah, right.
Right. And then Shake Shack got $10 million that they returned because they know that a lot of small businesses, right, were not afforded the,
they returned the money because they got busted, not because of any conscience or anything like that. They got busted, cold busted. They shouldn't have gotten a penny of it in the first place. Ruth Chris make great steaks, but that ain't good enough to get dollars to rescue.
25 million. Yeah. And so, Jackie, what can we do as individuals? What can we do on the local level in terms of environmental justice?
Yes. So in addition to fighting like H, according to Dr. Fuller, we could start to be the change we want to see in the world. One of the things we're doing as the Environmental Climate Justice Program is we're launching the Seeds of Resistance and Resilience so that we can start really building up food sovereignty in our communities. So as we try to push for better policies around around regulations and so forth, and as we try to push for shifting subsidies from big ag to elsewhere, we can start to build our own food sovereignty. So we're working with our branches and chapters to grow local food projects at an individual level, starting to grow our own herbs and so forth, or raise bed gardens in our backyard, and then at the community level in terms of having local food. There's so many awesome projects already out there, Soul Fire Farm in upstate New York, and there's so much that's going on, and we're really working with those very same folks to help us to be able to proliferate this. Similarly with energy, Lubna talked about the energy work and the solar trainings and so forth. We're also trying to get us so that we're building our own energy that's not from the polluting facilities that are leaving us more vulnerable to COVID-19. And
Right.
so we're also not subject to the heartless shutoffs that we're seeing with people having their electricity shut off for non-payment. We can actually own our own energy, our own clean energy, and that we're not subject to someone else flipping a switch and leaving us in the dark and in the cold. So to the greatest extent possible, we're really working on growing up our own locally controlled, locally owned in the commons, whether it's food, energy, water, and so forth. So those are some of the things that we're working on and really seeing as vital to us being able to be resistant and resilient in the face of whether it's the climate crisis or the COVID-19 crisis.
Lubna.
Yeah, so I think there's a number of things that we must be doing in order to advocate for the enforcement of existing air pollution regulations to protect human health for everybody. We need to ensure that organizations, community-based organizations like We Act are being funded and are positioned in a way that we can address what's actually happening. We have been really active in terms of COVID response, and ensuring that we're supported and continuing to build trust with our communities is highly, highly important. I encourage everybody to, visit weact.org. We have a number of campaigns that we're working on right now, some related to public housing, others related to LAHEAP, the Low Income Heat Energy Assistance Program. We're working hard to develop a plan to stimulate the economy around climate change, relating back to some of the, growing the green jobs workforce, green and good jobs workforce in this community here. Ensuring that like water shutoffs are not happening anymore.
Yeah.
I mean, we're asking people to practice hand washing, and there are environmental justice communities that either don't have water or are washing their hands with contaminated water. And it's like, these rules cannot be applied across the board because, some folks are not equipped with, the right tools to even battle this crisis. So I think the other thing is just really, getting out there, getting involved with your local organizations, and ensuring that the general public and some of our key decision makers understand that by helping, our most vulnerable communities, that in turn is really going to help everybody across the board. In the face of a crisis, for example, if we're able to equip people with the tools and preventative measures to combat this virus, that's going to slow the spread of the virus for everybody. And I think that, connecting those dots isn't happening enough yet.
Mr. Royal, there in Milwaukee on the local level, are you guys doing anything in terms of environmental justice, in terms of either equipping people with information, challenging elected officials, holding people accountable? Tell me what you're doing or what's being done or needs to be done on the local level in Milwaukee.
Well, there's a lot of need. When you talk about the city of Milwaukee, that's been listed as the worst city in the United States for African Americans to raise a family. When you look at it as being the ground zero for Black male incarceration, for 40 years of 50% Black male unemployment, 40 years of over 34% poverty. These are all systemic issues.
Yeah.
Some of the solutions that we've been working on with the city and the county is there's a sustainability committee that's looking at renewable energy and how do we put that into practice. We know that the state has invoked regulations that make it prohibitive for the city to benefit from, like as I alluded to earlier, solar energy tax credits, or they've prohibited height restrictions on turbine wind power so you can get off the grid. These things are intentional. So that's one area that we're involved in as far as sustainability and how to address these systemic issues that deal with environmental justice. But then we have to remember that just as folks have been eroding voting rights since they were enacted, civil rights have been eroded since the day the pen was inked on paper. So we need to revisit what civil rights that are currently on the books that are not being administered and enforced the way they're written. Because that's how, we've got these pockets of poverty across the nation.
Yes.
And every Martin Luther King Drive Avenue has a high rate of unemployment, a high rate of lack of affordable housing, a high rate of uninsured. And this is systemic throughout the United States. So I think that we have to go back and look at the civil rights that we fought for that have never been fully gained, just as the voting rights that we fought for are constantly being eroded.
Ooh, Mr. Royal, I think you said a word right there. I saw Lubna do this. I think you said a word right there, because that, you know, civil rights, that does tie into environmental justice in terms of where we live, how we live, education, housing, just as Dr. Bullard said, it's all intertwined, right? The housing, the education, the location of where we live, how the type of jobs that we're having. Let's do the federal government.
Ms. Joyner, could I
Yes.
just add one last comment on that? Because we did have that discussion on the color of law.
Yes.
And the color of law touches, it opens up about discrimination in housing, but it talks about how government and private industry collaborated to marginalize minorities, not only in housing, in employment, and how we were policed, and how the banking laws were giving affordable loans to individuals, how funds were distributed to schools by location. So it clearly lays out the data that folks were asking about,
Yeah.
of how minorities have been marginalized historically in this country, not only by the private industry, but also by the government.
How can we change that at the federal government level, though? I'll start with you first, and then I'll go backwards and end with Dr. Bullard. Yeah, because you know that those policies were put in, and now they're, you know, we see the impact of those policies, right? You know, so I'll start with you, and then I'll go backwards. Yes.
We should be seeing the impact of those policies, and they say that if you don't remember your history, you're bound to repeat it.
Yeah.
Now, Martin Luther King penned a letter that said, "Give me the ballot." But what he talked about in that letter were 4 different types of individuals, and one was the federal folks and their role in giving us access to civil rights and the ballot. Then they talked about the moderate Southern European Americans that needed to understand that lifting all tide rises all boats. The liberal Northern European Americans that said that, you know, we can move progress forward, but not so quickly. You know, take your time. Don't ask for too much too quick. And then the African Americans who will benefit from the system as it is in place. This dynamic hasn't changed.
Yeah.
And we still need to push the needle on equity. I'm not saying equality. Give me equity.
Right. So solutions, though, that you would like to see the federal government in terms of policy, you know, I'm looking for solutions in terms of policy that, you know, should be implemented.
Section 3 is opportunities to any federal project that states there's supposed to be certain quotas that go to low-income individuals for working, minority contractors for participation on those developments, minority procurement for participation on those developments. When we look at housing, low-income housing tax credits are set by the maximum amount of rent that is set on low-income housing is set by geographical boundaries or groupings that determine the average median income for an area, which gives that housing maximum amount of rent that can be charged on a low-income housing credit. Now those credits are benefiting the developers, not the intended low-income renter. Though, see, we got to get back into the laws that are on the books. The NAACP fought our battles on the court steps.
Yes, yes. So you're suggesting that we need to look at current policy in holding people accountable for what's on the books right now, because the current policy is not being enforced.
That
right?
would be a good start.
Okay, that would be a start. Lubna, federal government, what type of policies or I don't want to say regulations that we need to address environmental justice?
Yeah, I mean, I'll go back to some of the energy related, policies that should be enforced. I mean, after rent, energy burden is the second highest burden amongst, households, especially low income households. So ensuring that energy is affordable. So, one of the things that our federal policy office is involved involved in is ensuring that we fund, $7 billion for the low income home energy assistance program that will really help families with their energy costs related to energy bills, especially as we're sheltering in place and our energy bills are going up. That's becoming much more burdensome. Funding for weatherization assistance programs and making sure that households are better equipped, especially with the extreme heat months coming along. I mean, having access to air conditioners and extreme heat, which creates more stagnant air and triggers asthma episodes, which is going to be a huge issue as the crisis continues. Also, including 25 million for the immediate potable water distribution that I mentioned earlier.
Yeah.
And there's other, points of the stimulus package that are related to increasing access to internet. I mean, so many people do not have digital access, to get resources to, even understand what they can be doing to help themselves. So those are all a number of things that we're working on at the federal level.
Okay, thank you. And Jackie, I know you've been working, as head of the environmental and climate justice program at the NAACP. You guys have been working on policy, am I correct?
We have,
Yes.
definitely. So
Talk about that.
yeah, so a lot of the policies we've been pushing for have been at the state and local level, and then, but certainly at the federal level, one of the things that has made our jobs so hard is the unholy matrimony between, with corporatocracy, between kind of whether it's big oil, big ag, big coal, big waste, all these different entities, and not only our legislatures, but also our courthouses. So reversing Citizens United and then getting money out of politics in terms of campaign finance reform is a big one for us, just so that we actually have more of a democracy, so that the people are speaking in terms of the policies that are being advanced. We saw the rollback of environmental protections in the context of this COVID-19. So we need to restore, and then we need to strengthen, and then we need to monitor and enforce, as President Royal was saying, our environmental protections. Some of the specifics, we also need to retire the coal debt that's being held by the rural electric co-ops, because they're in a vice now of not being able to transition to a new energy economy that would be better for the environment and better for the health and well-being of communities, because they're weighed down by this coal debt. So if we retired it from a federal standpoint, then that would be helpful for the rural electric co-ops. Establishing a national renewable portfolio standard, establishing a national energy efficiency resource standard, making sure that we don't have fossil fuel bailouts, as was stated before, as it relates to the stimulus packet, but then also removing subsidies for fossil fuels that are, again, harmful for our communities and harmful for our environment. And so moving those, any financial assistance to shoring up the research and development and implementation of clean energy. So those are just a few examples. Certainly we need to shift the whole housing, whether it's the USDA or Department of Housing and Urban Development, make housing ownership and land ownership a lot more accommodating, supporting community land trusts and removing barriers around community land trusts, and then definitely removing subsidies from big ag, so that we have more in terms of raising up local food projects that really keep healthy, nutritious, life-sustaining, immune-boosting foods in our community. So those are just a few examples from a federal level. Thank you.
Ooh, Jackie, let me tell you how you started. You started with big oil, legislators, and courts, all working in cahoots.
Yes.
Am I
Absolutely.
all working in cahoots?
Yes.
To not basically uplift I don't want to say uplift, to empower our communities, right? To keep things as they are.
Yes.
Am I correct?
Absolutely.
Not to improve the conditions in vulnerable communities, but they're working hard to keep things as they are. Is that
Yes, and not only from an environmental standpoint, but even some of these companies are using their profits to pay into groups like ALEC, the American Legislative Exchange Council, which
Ooh,
advances everything from voter suppression to school privatization to prison privatization to water privatization, all the things that are harming the civil and human rights of our communities. We're literally being financed by this unholy matrimony. So getting money out of politics that's why it was at the top of my list. Again,
yes,
getting
getting money out of politics. Jackie, I want to give you this right now.
thank you.
Dr. Bullard, we're at time, so I'm going to go to you to close us out in terms of policies, in terms of solutions at the federal level. Jackie just told us about this unholy marriage of big corporations, of courts, of legislators working to keep things as they are and not improving the conditions of those in our most vulnerable communities. So I'm going to end with Dr. Bullard, and then I'll close us out. Yes.
Well, I agree with everything that's been said, and I think understanding that this country was founded on 4 principles: free land, free labor, free men, free enterprise, land stolen from Native Indigenous people, free labor, labor not cheap labor, slave labor, Africans doing slave labor, free men, only white men with property could vote and who were free, and free enterprise. There is no such thing as a free lunch. The bill comes due when you add all these things together, and the collusion and all the things that corporate and business and government, and sometimes you can't tell the difference. The result is the inequality across the board, and the solution is we have to dismantle this unholy alliance, and one way to do that is to hold elected officials accountable and vote.
Yes.
It does make a difference who's in charge of our city council, county commissioner, who's in the governor's seat, and who's in the White House. Vote. And one vote can make a difference, and it's going to be close. And anytime it's close, that means that we have to do more to vote. And NAACP and Crisis Magazine and W.E.B. Du Bois, one of my heroes, not a dead white man sociologist, but a kick-ass sociologist who I have patterned my whole career after to do kick-ass sociology and to make a difference.
Good stuff. Great panelists. I'm giving all of you guys a hand. Thank you so much for taking time out today to talk about environmental racism and the coronavirus COVID-19. This was the very first episode of Crisis Conversations, and I just think you guys did an awesome job, a phenomenal job for putting all the cards on the table. I love, Dr. Bullard, how you ended with vote, because your vote does make a difference. I want our listeners and those who are on Facebook and in our chat box to tune in tomorrow for the NAACP and BET virtual town hall on education. And if you want to know more about resources for the coronavirus, sign up for updates on NAACP.org. And next week, we are going to be talking about economics. We are going to feature people who have been furloughed and small business entrepreneurs who have been impacted by the coronavirus COVID-19. So thank you, everyone. I hope you have a good afternoon.